Well, in the time left to us, I'd like to cover another problem that I think you see quite frequently, and that is fractures, particularly hip fractures, which seem to be very common, I think, in all countries, I'm sure, particularly in India. Could you tell us a little bit about hip fractures in older people and what the options are if, say, somebody is elderly, parent or grandparent falls and breaks a hip? What options do they have?
Yes, well said. Because just like we use the knee as something to build on and talk about all around it, similarly, fractures are in the younger population, and those are high energy fractures. Like somebody gets hit by a motorcycle or falls or car accident and or falls from a height. So those are high energy fractures, mainly in younger people. And then there are the so-called fragility or lower energy fractures in older people. So now if you have a person who is even 60, 65, 70, or whatever it is, the issue is what force was exerted on that patient when he fell. For example, you have a person that falls down an entire staircase, like we have apartments in India. And if you're walking up an apartment like a flight of 15 steps and you fall down, that's more energy than somebody who trips at home and falls. So just remember this sort of broad uh, uh, classification or distinction. And coming back to hip fractures are very common all over the world, and it gets commoner as we get older. You see it in the elderly, and that's why many of them are called fragility fractures, because the bone is already fragile, as is the person. So when they fall, then they commonly break something. And when they break something, then the goal of the treatment sorry, is to make sure that the patient can be up and moving. If you put a patient, any patient, especially an older person, put them on the bed and tell them not to move, that is a great disservice to them and also decreases their ability to survive that injury. So whatever it takes, if the fracture that they sustained is a stable fracture, then they should be up and about. If the fracture is unstable, then it should be fixed or treated surgically, with the goal of the treatment, whether surgical or non-surgical, is to get the patient off the bed and standing and walking.
Are hip fractures in the elderly, just as you mentioned, the fragility fracture, are they very painful?
Yes, they are painful, and that's the other problem you have, that it's the surgical treatment sometimes is only done to alleviate pain. I always say this to my patients. I said, look, if you say we don't want somebody to have an operation, then how are you going to treat the pain? With medicine? But medicine, that degree of medicine that you need to take away the pain completely, will almost upturn the patient. So if you turn a patient, for example, to clean them, that's very painful with a hip fracture. All right. So you need to do multimodal treatments. You need to be more aggressive. But that's, again, I'm a surgeon, so that's my take on it. That be aggressive. Don't treat them as 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 somebody that you don't need to do anything, or he'll be all right. Get them up, give them a chance, and most important thing is mobilize activity. Get them up, get them sitting, get them standing, get them walking.